Patricia Thomas, a registered nurse, and this is National Nurses Day. And I chose to shoot this video because I've been asked by several of my peers to do this video because I have been talking about this for quite some time, maybe like a month. And what I've been talking about is the feeling of betrayal. Have you guys ever been betrayed? This video, if you like or dislike it, please click like or subscribe to my channel because I will be starting a YouTube channel. And everybody who knows me knows that this is a stretch for me, but a lot of people have encouraged me to do it, so I'm going to jump out here and do it, and I got a lot of learning to do. But at any rate, I want to talk about the betrayal that I'm talking about. And that betrayal is, as a registered nurse, it's very difficult for me to be excited about National Nurses Day as a whole because I basically feel betrayed as a frontline worker. A frontline hero is what people are calling us. Now, we don't think that we're heroes, but that's what we are being defined as during this time. And it's really alarming to me because if I am a hero, truly, then protect me. Then make sure that the asymptomatic hero get tested. Now, I want to thank everybody around this country who has rallied around frontline workers, not just nurses, but police officers, firemen, essential workers in our stores. And we are so excited and we're so appreciative. All of us are so appreciative. And to the big box stores who have started initiatives where we can come at certain hours and buy our goods, thank you, thank you, thank you, Sam's and Costco's. But I am so disappointed and I feel somewhat betrayed. And if you do, let me know in your comments below if you feel the same way, if you are a frontline worker, an essential worker, even if you are an asymptomatic citizen in this country. Because for the asymptomatic frontline worker or citizen, we don't have any place to go. We just don't have any place to go. If you're symptomatic, there's a lot of places to go to get tested. And where I am, we had our first free all out testing about 2 Saturdays ago. And a lot of people got tested, and you didn't have to have any symptoms when you came there. And I was so happy. And a lot of people got tested, but you guys know there was like a mile long line that didn't get tested. And in that mile long line, there was a lot of frontline heroes. It really was. So, my question to mayors and to governors and to Mr. President, my question to you guys are, if there are free testing that you can be asymptomatic and get the test, can you guys do like some of the big box stores have done for us? The heroes, is it too much for us to ask this as heroes? That if 20,000 tests comes to an area, any area, can 10,000 of those tests be given and allotted to the frontline essential workers? Can they? Can they? And have them distributed in places that are conducive for them. Because you guys, after we've worked those 12, 16, 20 hours caring for everybody, we're exhausted. We're exhausted. So if we can get those tests in areas that are conducive to us, like if you're a police officer, if there's a precinct in the area that can test on a certain day at a certain time, would that be good? If you are a fireman at a fire station, a local fire station where you can come at a certain time and get the test done. A nurse in the hospital that you work. I mean, we already have people in the hospital that are equipped to do this, you know, our infection preventionists as well as our employee health nurse. So I'm just asking. I'm just asking. And to essential workers who's throughout the community, where we have stores where they have nurses in there, can that be a spot? Now, I'm not saying that we shouldn't test community. We should test community. We are a part of community. That's why I'm asking, could half of those tests be allotted to your asymptomatic frontline workers, you guys? And the reason why this is such a problem for me is because the asymptomatic people are getting tested. But you know, guys, I've talked to so many frontline heroes, nurses, doctors, social workers. I've talked to unit secretaries, and they have lied. Yes. But no judgment here. No judgment. They did. But you know why they did? Because they were forced to. You know why they was forced to? Because in order for them to know their status, they had to not tell the truth to get the test. Now that to me is preposterous because as a healthcare worker and as a person in the field of health that says, listen, we got to know your numbers to the community, know your status to the community. We want to know our status. We're driven to know what's going on with us. But because the way these tests and how things were set up, they were only for the symptomatic person. But however, we all know because we're following the science, guys, we all know that the asymptomatic person is also shedding this virus and passing this virus along. I think so more so than the symptomatic. Let me tell you why. Because now, I ain't no expert at this, but I'm a person who follows trends and I'm a person who listens to the science. And I'm a person who've done research because I have higher degrees. I am the type of person that when I see that the sick people are coming in to be tested and this virus, this dreaded COVID-19, this pandemic is just getting larger and larger and affecting more people and people are dying more. We're already at 70,000. Come on, guys. We gotta know that people who are not showing symptoms of spreading this. We gotta know that. We just gotta know that. Now, everybody who has the virus is not getting sick. And they think they're okay. And they think they can walk around here with no mask and no gloves and not washing their hands and not sanitizing. Well, guess what? On National Nurses Day, shouts out to Florence Nightingale. Because in the 19th century, and we're in the 21st century, in the 19th century, she taught us that washing your hands, just simply washing your hands, slow down spreading germs from 42% to 2%. Fact check me. All right? So we got to continue social distancing. We got to continue washing our hands, being aseptic and cleaning areas. We got to do this, guys. We got to not go to large gatherings. We got to do this until we get a handle on this dreaded pandemic. And as for the nurses, this is National Nurses Week, you guys. I'm pleading to all of the nurses. First of all, thank every last one of us who are putting our lives on the line every day, along with everybody else who's doing it. But as a nurse, and this is National Nurses Day and National Nurses Week, let's fight to know our status. And we shouldn't have to lie. Because lying, you guys, skews the data. What do you mean, Latricia? It skews the data because if I show up saying that I am symptomatic, means that I got a cough, I got a fever, I've been exposed, and say I say that and it's not true, but I want the test. So I get the test and I test positive. Guess what, you guys? I now go in the population as the COVID 19 positive person who was symptomatic. When in all honesty, I was not. So I believe a lot of people who tested positive, I believe they were asymptomatic people. Just a thought, just a belief. Because I've talked to citizens, frontline workers, and they have told me in the masses, we just told them we had a fever. We just told them we had a cold. We told them been exposed. Because they wanted to test. No judgment, no judgment, you guys. But it will skew our data, and we won't really know what we think we know. Because junk in is junk out, right? Right. Okay? So, you guys, let's continue to practice social distancing, washing our hands, wearing our protective coverings, and not doing large gatherings. Yes, I want our economy, like everybody else, to come back. But let me tell you the reality of this. We have to know. We have to know that wealth without your health, it ain't good. And we also have to know that health without wealth is not good. We have to find a balance. We have to find a balance, you guys. And we need to go gradually. We really, really do. And again, from all of the nurses in this country and around the world, happy Nurses Week and happy National Nurses Day. And to all of you who've given us free PPE, free food, free travel, free housing, free scrubs, thank you, thank you, thank you, thank you. But mayors, governors, Mr. President, we feel betrayed. Because what we need more than anything are free testing. We need free testing. It is that too much to ask for a hero. God bless you all, and God bless America. I am Latricia Thomas, and I am humbled and honored to be a nurse. Let me know if you like this video. I'll be coming once a week with different videos and especially updates on this horrible coronavirus.